Thank you, Mr. Chairman. It's so obvious that a disaster changes everything. And 9/11 and Katrina, we can't really unlink the two because the same thing virtually happened in both areas. Proves to us that we have to have systems in place so when something that disastrous happens, we can rely on those systems to the best of our ability, not make it worse. There's going to be other disasters of one kind or another, and there are going to be future heroes. So what we have to do from 9/11 is learn, not get defensive. We have to learn what should have been done. We have to learn what can be done in the future, and what must be done for our workers for their health effects, because it's a three-part solution that we have to be looking at here. And I thank you all for what you've provided us today. But when you have a near miss, and I know that OSHA, this is part of OSHA's strategy, you learn from a near miss. Well, we have a lot to learn from the OSHA response. And my question, and I'm going to ask this of all of you because I'm sure you have an opinion. When we talk about comprehensive enforcement, and I'm going to start with you, Dr. Melius, when we look for comprehensive enforcement, who should be in charge? We've got to have somebody in charge. Is it OSHA? Is it EPA? Where was FEMA? Or is it the local folks? Who do you think should be in charge? What should the hierarchy be? Because when major decisions are being made during a major disaster, we need to know who's in charge.
I believe it should be OSHA should be in charge of ensuring worker safety at the site of a disaster and the follow-up to that disaster. And they need to be able to comprehensively assess the hazards. They need to be able to then decide what needs to be taken in terms of protecting people, advise people of what that protection should be, what steps should be taken. They need to then be able to enforce and make sure that that protection is implemented. One of the problems here is that when that enforcement is delegated to different agencies, like the city here, the contractors, different city agencies involved, is that the rate of compliance was varied greatly. If one visited the site, as I did repeatedly and just observed, you would see that some groups, there was, again, using respirators as an example, there was excellent compliance. 90% of the people were wearing respirators all the time, or even higher. In other groups, nobody was wearing respirators. And it's extremely frustrating because it was very confusing for people on site. People were still listening to, believing EPA Administrator Whitman's pronouncement that the air was safe, so there's a lot of skepticism over the need for providing protection. And one needs one strong central authority to be able to do that. So and I'll just add that I don't believe that if there was enforcement action, that you can assume that every agency on site is going to contest the enforcement actions. I think most of them actually would have complied, and I think really in reality most people would have welcomed a strong, strong voice that was in charge of safety at that site.
Thank you, Dr. Jackson.
Well, in thinking about who should be in charge for safety, we, in our work, sort of went to look at the operational side of response, for an example. And in that case, you have the incident command system, where who's in charge of the incident is the incident commander. Fundamentally, the responsibility for safety at any incident is with the operational commander, because they're the ones who are making the risk decisions about what needs to be done and what risks need to be taken to do it. But in order for that to work, the model that we talked about in our work is that you actually need a multi-agency approach to doing that. As it's been mentioned, OSHA wasn't the only agency that was doing hazard monitoring. The EPA was there, NIOSH was doing some hazard monitoring, and the point is that for all of that to work, for hazard monitoring to be credible, for people to act on it, there had to be a structure to bring that together, rationalize it, figure out what the one answer was, and then implement based on it. And so, it really, from our perspective, it's not just a question of who should be in charge, but how you put that structure in place to bring together everything that needs to support that person who's in charge.
So then, Ms. Clark, why don't you talk to us about if it falls on OSHA, what do you need to be able to hold that together, to be that agency?
Well, like Dr. Jackson, I understand that we're going to be working in an incident command system. It's usually a unified command when it's something of this magnitude, with many agencies, both at all levels, federal, state, and local. Under the current National Response Plan, with the implementation of the Worker Safety and Health Annex, we now have the coordinating role, in other words, the lead role. That's something we recommended as a lesson learned from World Trade Center. In fact, within the annex, it talks about what that annex covers, and it covers all of the things that I mentioned we did at the World Trade Center. That's how we put those recommendations together. We have the lead, but there are coordinating agencies, such as NIOSH, the Centers for Disease Control, EPA, the Corps of Engineers, the other ones who would be working with us at the federal level. This is all handled through a joint field office, which is established where all of the federal agencies are located. There also is a state coordinating official, because as I think Dr. Jackson also mentioned, responses are local. That's how they start. Even for incidents of national significance, that's where they start. And eventually, there may be a recommendation that goes up to the president to make it a nationally recognized disaster. But you need to start with the locals. We are working with them very closely in New York City and in the rest of the country to try to coordinate these things. But I think that Worker Safety and Health Annex is a very good start. It was used in Katrina in the early days. It was the very first time we were not exercising it, but implementing it. We learned a lot from that, and we're learning more and more. Now the response plan is being recrafted. I think the chairman referred to the fact that there's a national response framework now that is being put together. And we're working on that as well. So I think it's really important that we do have a coordinating role, a lead role, but that we have to recognize it's going to be a unified command, and the locals are going to be very instrumental in having the lead on this.